As nurses, we understand the worry and concern that comes when noticing your feet and ankles are swollen. Swelling of the feet or just a foot is a common occurrence that can be caused by a variety of factors ranging from mild to severe. While some causes of swollen feet are relatively harmless and can be managed with simple lifestyle changes, others may indicate a more serious underlying health condition that requires medical attention. Welcome to our video on all the possible reasons why feet swell and when you should see a doctor. Before we begin, please do us a huge favor. Like this video and consider subscribing if you haven't done so yet. And hit the bell icon so you get notified whenever we post something new. Your Wellness Journal is run by nurses and we aim to provide informative health videos from the perspective of medical professionals who have been trained to care for you. Let's begin. Swollen feet and ankles are a common issue many people experience from time to time. While mild swelling is usually not a cause for concern, persistent or severe swelling could be a sign of an underlying health problem. Another common reason for swollen feet is an injury. In this video, we are going to be starting with the most common and less concerning causes of leg and foot swelling. Later on, we will move into the potential health conditions that could be causing the issue. We will also be giving you some guidelines on when you should be seeing your doctor, as well as when it is an emergency matter. Then, we will also be giving you some prevention and home care tips. So, what are the common causes of swollen feet and ankles? Let's discuss some of the most frequent reasons why you might be dealing with this issue. Prolonged standing or sitting. When you're on your feet all day or stuck at a desk without much movement, fluid can accumulate in your lower extremities, leading to swelling. Pregnancy. Swollen feet and ankles are common, particularly in the later stages. However, it's important to note that sudden or excessive swelling during pregnancy may indicate a serious condition called preeclampsia. Seek immediate medical attention if you suspect preeclampsia, as that can be life-threatening for both you and your baby. Foot or ankle injuries. Injuries such as a sprained ankle are frequent culprits behind swollen feet. When you sprain your ankle, the ligaments that support the joint become stretched or torn, causing inflammation and swelling. Being overweight. Extra weight can put additional pressure on your feet and ankles, making you prone to edema in these areas. And increased age. As we age, our veins become less efficient at pumping blood back to the heart, which can contribute to swelling in the lower extremities. Of course, while these are some of the most common causes of swollen ankles and feet, there can also be other factors at play. These factors can include certain health conditions, such as venous insufficiency. This is a condition where the veins in your legs have trouble sending blood back to your heart. Things that can lead to venous insufficiency include previous blood clots in your legs, varicose veins, being overweight, pregnancy, and sitting and standing for a long time without moving. It can also be caused by a blood clot in your leg or deep vein thrombosis. This is a blood clot in your leg that can impair blood flow, leading to swelling and discomfort. It is important to seek medical attention if you suspect you have a blood clot, as it can be life-threatening if it travels to your lungs. Another possible cause of swelling is heart failure. With heart failure, your heart is unable to pump blood effectively. Fluid can build up in your feet, ankles, and legs because of this. According to the American Heart Association, more than 6 million Americans are living with heart failure. Swelling of the feet and legs can also be caused by kidney disease. Your kidneys play a crucial role in removing excess fluid from your body. When their function is impaired, fluid can accumulate in your tissues, causing swelling. Liver disease or cirrhosis. Cirrhosis can cause low blood protein levels, which allows fluid to leak into your tissues, leading to swelling in your feet and ankles. Lymphedema. This is a condition that occurs when there's a blockage in your lymphatic system, causing lymph fluid to build up in your tissues. A 2019 study in the Journal of Clinical Medicine estimated that lymphedema affects up to 250 million people worldwide. It can be caused by a number of reasons, including a parasitic or viral infection. And speaking of infections, swelling of the feet and legs can also be caused by infection or cellulitis. Cellulitis is a bacterial skin infection that can cause redness, swelling, and pain in the affected area. If left untreated, it can spread and cause serious health problems, including swelling. Other potential causes of foot and leg swelling, aside from the medical conditions mentioned, include certain medications and alcohol consumption. Certain medications can cause fluid retention, resulting in swollen feet and ankle. These include antidepressants, especially MAO inhibitors and tricyclics, blood pressure medications like calcium channel blockers such as amlodipine and nifedipine, hormones like estrogen and birth control pills or hormone replacement therapy, and testosterone. Steroids can also cause swollen legs and feet. If you suspect your medications might be causing swelling, don't stop taking them without consulting your doctor first. They can help determine if an alternative medication or dosage adjustment is needed. Another potential cause of swollen feet is alcohol consumption. Alcohol consumption can cause leg and foot swelling through several mechanisms. As a diuretic, alcohol leads to dehydration, causing the body to retain water and accumulate fluid in the tissues. Drinking alcohol can also temporarily raise blood pressure, and chronic alcohol use can lead to persistently high blood pressure, causing fluid to leak from the blood vessels into surrounding tissues. Excessive alcohol consumption can also damage the liver, leading to cirrhosis and decreased production of proteins that help keep fluid in the bloodstream. Long-term alcohol abuse can weaken the heart muscle, causing fluid buildup in the body. Chronic alcohol use can also lead to malnutrition, causing low levels of essential proteins and contributing to fluid retention and swelling. So now, when should you see a doctor? While mild swelling in the feet and ankles is common and is usually not a cause for concern, there are times when it's important to seek medical attention. If the swelling is severe, painful, or persistent and doesn't improve with home remedies like rest and elevation, it's time to talk to your doctor. It's especially crucial to seek help if the swelling is accompanied by other symptoms such as shortness of breath, chest pain, confusion, as these could be signs of serious conditions like blood clot in the lungs, or a pulmonary embolism or heart problems. Another red flag is asymmetrical swelling, where there is only one leg significantly more swollen than the other. This could indicate a blood clot in the leg or deep vein thrombosis or a lymphatic system blockage. If you have a history of heart, liver, or kidney disease, it's important to be vigilant about any changes in your swelling, as these conditions can cause fluid retention. In such cases, your doctor may need to adjust your treatment plan or medications to better manage your symptoms. Remember, if you're ever unsure whether your swelling is a cause for concern, it's always best to err on the side of caution and consult your healthcare provider. They can help determine the underlying cause and recommend the most appropriate course of action to keep you healthy and comfortable. Of course, there are times when swelling of the leg is an emergency situation. These include when swelling comes on suddenly and is accompanied by chest pain, difficulty breathing, and dizziness. Swelling in one leg is also a concern when accompanied by pain, low-grade fever, and skin discoloration. This could indicate a blood clot. Severe swelling during pregnancy is also a concern when accompanied by headaches, abdominal pain, and nausea. This may be a sign of preeclampsia. Now, for how to prevent leg swelling and how to care for leg swelling at home. Some of the things you can do to prevent leg swelling include avoid prolonged standing or sitting, lose weight if you are overweight, exercise regularly, and reduce your salt intake. To help treat the condition at home, you can elevate legs above the heart periodically, wear compression stockings, massage swollen areas, and soak feet in cold water. If you want us to talk about any of the conditions we mentioned in this video, please let us know and we'll do that for you. For more videos from us, check out the link to our other videos on your screen now. We'd love to hear from you. Have you ever experienced swelling in your feet or ankles that you initially ignored but later realized was a sign of a more serious issue? Share your story in the comments below. We value your input, and it will also be a great place for the Wellness Journal community to learn from each other's experiences. We hope you found this information on the various causes of swollen feet and ankles, when to see a doctor, as well as home care tips, informative and helpful. Don't forget to like, share, and subscribe to your Wellness Journal for more educational content on health and wellness topics from a channel run by nurses. Feel free to check out our other videos now. Thanks for watching, and we'll see you in the next video. We are your Wellness Journal. Have a healthy day.